World Health Organization has called on Afghanistan's Taliban authorities to lift restrictions preventing female aid workers from assisting women in earthquake-hit regions, after reports revealed that male rescuers were barred from touching female survivors. The magnitude 6 earthquake on September 1st, along with its aftershocks, has killed more than 2,200 people, injured over 3,600, and left thousands homeless in a country already struggling with severe aid cuts and a humanitarian crisis since the Taliban takeover in 2021. Dr. Mukta Sharma, deputy representative of WHO in Afghanistan, emphasized that the severe shortage of female medical staff is hampering care, as women are often uncomfortable or afraid to receive treatment from male doctors, and the strict no-skin contact rule has worsened the situation. Sharma explained that around 90% of medical personnel in the affected areas are male, while the remaining female staff are mostly midwives and nurses, rather than doctors able to treat severe wounds, leaving many women without proper medical care. The WHO team has repeatedly raised concerns with Taliban authorities, advocating that female aid workers be allowed to travel without male guardians and assist women in need. Yet, no formal exemptions or permissions have been provided so far. Survivors' testimonies reveal the human cost of these restrictions. A 19-year-old woman from Kunar province, named Aisha, said no one approached her or other women for help, highlighting how Taliban-imposed rules on male-female interaction turned an already devastating disaster into a deeper tragedy for women. The Taliban have stated they respect women's rights according to their interpretation of Islamic law and have promised that women would be able to receive aid, but the ongoing restrictions, including bans on female doctors' training and harassment of aid workers, continue to impede relief efforts. Dr. Sharma underscored the urgency of allowing female staff into quake-affected areas, explaining that bringing in trained women from other regions is essential to provide critical care and prevent further loss of life among women. The situation in Afghanistan highlights a stark reality. Natural disasters do not discriminate, but the lack of women in relief operations means Afghan women remain the last to be saved, if at all. The WHO and other humanitarian agencies continue to press the Taliban to lift restrictions and prioritize the safety and health of women in quake-hit regions, even as Afghanistan grapples with compounding crises. For full updates on Afghanistan's earthquake relief and women's access to aid, subscribe to our channel, The Indian Express.